Most people do not think about their kidneys until something goes catastrophically wrong. They are simply two organs tucked away quietly, doing their work without ever demanding your attention. But your kidneys are doing something extraordinary every single day. They filter approximately 200 liters of blood. They remove toxins. They regulate your fluid balance. They maintain electrolyte levels, produce hormones, and keep your entire physiology in equilibrium. When they start to fail, your whole body begins to deteriorate, gradually at first, then with increasing momentum. Here is the part that makes this so dangerous. Early kidney disease is largely preventable and manageable when caught early. But most people do not catch it early because they do not know what to look for. The symptoms are subtle and easy to dismiss. By the time they become obvious and undeniable, significant damage has already occurred. I have spent years watching people arrive with kidney failure that could have been prevented. When reviewing their histories, the warning signs were almost always there, present for months or years, but nobody connected the dots. Nobody recognized that persistent fatigue, or foamy urine, or unexplained swelling were early distress signals from struggling kidneys rather than ordinary aspects of getting older. Today I want to change that for you. We are going to walk through 7 early warning signs that your kidneys are under strain, with the physiology behind each one and how to distinguish normal variation from symptoms that require medical attention. My name is Dr. Victor Hayes. Your kidneys cannot speak to you directly, but they are sending signals. Let us learn how to read them. Warning sign number 1 is foamy or persistently bubbly urine. Occasional foam when you urinate is normal, particularly if you are slightly dehydrated or urinating with force. What is not normal is persistent foam that does not dissipate quickly, foam that looks similar to soap suds, foam that appears most times you use the bathroom. This is a marker of proteinuria, the presence of significant protein in your urine. Here is what is happening inside your kidneys. Each filtering unit contains a structure called a glomerulus, a bundle of tiny blood vessels with a sophisticated filtration membrane designed to let small waste molecules through while keeping larger, valuable molecules like protein in your bloodstream. When this membrane is healthy, almost no protein passes into your urine. When the filtration barrier becomes damaged from diabetes, high blood pressure, inflammation, or other causes, it begins to leak. Proteins, particularly albumin, pass into the urine. These proteins then act like soap when urine is voided, creating foam that persists. The presence of protein in urine does not just indicate kidney damage, it actually accelerates the damage further, triggering inflammatory responses and oxidative stress in kidney tissue, creating a vicious cycle. If you are noticing persistent foam, most times you urinate, especially alongside any of the other signs I will describe. See your doctor. A simple urine dipstick test can detect protein within minutes. Early detection and treatment of proteinuria can significantly slow the progression of kidney disease. Warning sign number 2 is swelling in the ankles, feet, or legs. Many people attribute ankle swelling to standing for long periods or warm weather, but persistent swelling that does not resolve, that is worse at certain times, or that leaves an indentation when you press on it. This can signal kidney dysfunction. The mechanism connects directly to what we just discussed about protein loss. As protein leaks into your urine, blood protein levels fall. Albumin in your bloodstream creates what is called oncotic pressure, a force that helps keep fluid inside your blood vessels. When albumin levels fall, that pressure decreases, and fluid leaks out of blood vessels into surrounding tissues. Gravity pulls this fluid downward, which is why you see swelling in the ankles and feet first. As kidney function worsens, the kidneys also lose their ability to excrete sodium efficiently. Sodium retention drives water retention, because water follows sodium wherever it goes. This further increases total body fluid, compounding the swelling. Occasional mild ankle swelling after a long day or a flight is normal. Persistent swelling that does not respond to leg elevation, swelling that is worse in the morning, or swelling that pits when you press on it, these warrant investigation. A blood test for albumin and a urine test can begin to clarify whether the kidneys are involved. Warning sign number 3 is a specific type of fatigue, profound, persistent, and unlike ordinary tiredness. When kidney function declines, the kidneys reduce their production of a hormone called erythropoietin, or EPO, which signals your bone marrow to produce red blood cells. With less EPO, fewer red blood cells are produced, and you become anemic. Anemia means reduced oxygen carrying capacity in your blood, which means less oxygen delivered to your muscles, your organs, and your brain. The resulting fatigue is distinct from ordinary tiredness. It is not the kind that improves with a good night's sleep or a cup of coffee. It is a deep, heavy exhaustion that makes even simple tasks feel overwhelming. You might find yourself breathless with minimal exertion as your body tries to compensate for reduced oxygen delivery. Climbing stairs that never challenged you before becomes noticeably difficult. Your concentration fades. Mental tasks that used to feel straightforward now require significant effort. Because this anemia develops gradually as kidney function declines, people adapt to it. They tell themselves they are just getting older, working too hard, not sleeping well enough. By the time it prompts medical investigation, significant kidney damage may already have occurred. A full blood count will reveal anemia. Further testing can confirm whether it is related to reduced EPO production from kidneys rather than iron deficiency or another cause. Once identified, the underlying kidney disease still needs to be addressed. Warning sign number 4 is waking frequently during the night to urinate, nocturia. Healthy kidneys concentrate urine during sleep. Your body produces antidiuretic hormone at night, which signals your kidneys to reabsorb more water and produce less, more concentrated urine, allowing you to sleep through the night undisturbed. When kidney function declines, this concentrating ability is lost. Damaged kidney tubules cannot respond properly to the antidiuretic hormone signal. They cannot reabsorb water efficiently. The result is that your kidneys continue producing dilute urine throughout the night, your bladder fills repeatedly, and you wake frequently. This is fundamentally different from nocturia caused by drinking fluids late in the evening or from an overactive bladder. It reflects a loss of the kidney's basic ability to regulate fluid balance according to your body's circadian rhythm. The pattern to watch for is progressive worsening. Waking once a night if you are over 50 is relatively common and not necessarily concerning. But waking 3, 4, or 5 times nightly, particularly if this has developed relatively recently or if it is accompanied by producing large volumes each time, warrants evaluation. Warning sign number 5 is persistent puffiness around the eyes, particularly noticeable in the morning. The skin around your eyes is among the thinnest and most elastic in your body, making it particularly susceptible to showing fluid accumulation. When you are losing protein through your kidneys and your blood albumin level falls, fluid does not stay within your blood vessels as effectively. During sleep, when you are horizontal, this fluid distributes more evenly throughout your body rather than pooling in your lower extremities. The loose tissue around your eyes readily accumulates fluid, creating puffiness that is typically most noticeable when you first wake up and gradually improves as the day progresses and you are upright. The important distinction: not all puffy eyes indicate kidney problems. Allergies, lack of sleep, and normal aging can all cause periorbital swelling. The significance increases considerably if eye puffiness is accompanied by foamy urine, ankle swelling, or persistent fatigue, or if you have risk factors for kidney disease like diabetes or high blood pressure. Warning sign number 6 is muscle cramping, particularly cramps that occur at rest, at night, or in unusual locations. Your kidneys are responsible for maintaining precise electrolyte balance, particularly sodium, potassium, calcium, magnesium, and phosphate. These electrolytes are critical for normal muscle contraction and nerve signaling. When kidney function declines, the ability to regulate these electrolytes becomes impaired. Levels can become too high or too low, and the balance between them shifts. Muscle cramps occur when the electrical signals controlling muscle contractions are disrupted, which electrolyte imbalances directly cause. Low calcium makes muscles hyperexcitable. Low magnesium impairs relaxation. Abnormal potassium levels disrupt the normal electrical activity of both nerves and muscles. Cramps associated with kidney disease tend to be more severe and more frequent than typical exercise-related cramps. They often occur at rest or at night. They may be accompanied by weakness, numbness, or tingling in the extremities, or a sense of your heart racing or skipping. A comprehensive metabolic blood panel will reveal electrolyte imbalances alongside kidney function. This is something to bring to your doctor rather than attempt to manage with over-the-counter supplements, because adding certain electrolytes in the context of kidney disease without proper testing can cause serious harm. Warning sign number 7 is persistent itching that does not respond to typical treatments. This is perhaps the most unexpected kidney symptom, one that seems to have nothing to do with kidney function, yet is well documented in the medical literature as a sign of advanced kidney dysfunction. As kidney function declines, waste products that should be filtered out of the bloodstream accumulate. Some of these waste products are deposited in the skin, where they trigger inflammatory responses and persistent itching. The kidneys also fail to properly regulate calcium and phosphate, leading to hormonal changes that further contribute to the itch sensation. Additionally, the metabolic disturbances of kidney disease affect nerve function, producing neurogenic itching, where the sensation occurs without any visible skin changes. This is particularly distressing because it is typically resistant to antihistamines, moisturizers, and most standard itch treatments. The pattern to recognize: widespread itching not localized to a rash or bite that persists despite treatment, that is often worse at night, and that is accompanied by any of the other signs described in this video. If you have unexplained persistent itching alongside other kidney warning signs or known risk factors, testing is essential. The common thread through all 7 of these warning signs is that they each represent different aspects of kidney dysfunction manifesting in observable ways. Foamy urine shows filtration membrane damage. Swelling shows fluid regulation failure. Fatigue reflects anemia from reduced EPO. Night urination demonstrates lost concentrating ability. Eye puffiness reflects fluid redistribution from protein loss. Muscle cramps signal electrolyte dysregulation. Persistent itching indicates waste accumulation. None of these signs in isolation guarantees kidney disease. Having 1 or 2 does not mean your kidneys are failing, but they are signals worth taking seriously, particularly if you have risk factors like diabetes, hypertension, or a family history of kidney disease. The earlier kidney disease is detected, the more opportunity there is to slow its progression, prevent complications, maintain quality of life, and extend healthy years. The tragedy is that most people ignore these warning signs until they are already facing advanced disease, at which point management becomes the goal rather than prevention. If you recognize yourself in any of these signs, speak to your doctor. Ask specifically for kidney function blood tests and a urine albumin test. These investigations take minutes and can catch early damage when intervention is still highly effective. Your kidneys cannot speak to you directly, but they are constantly sending information. The question is whether you are paying attention. Please subscribe to this channel and share this with someone who needs to hear it. I will see you in the next video.